good evening, everyone. Today, I'm going to start our next part of the colon and rectum, which is most important. Till now, अब तक हमने benign disorder cover करा था. We covered the diverticula, we covered the volvulus, we covered the anatomy and physiology, and we covered the ulcerative colitis, and we also covered Crohn's disease. So today, we're going to start the basically colon and rectum tumors, and this given in a काफी बड़ा topic है ये, and most likely we're going to cover in the 4 and 5 sessions, right? So I hope you are enjoying this series, Marching Billions Sebastian, and I hope this series is helping you to read the standard textbook. Basically, the concept is like just before the day of the surgery, two friends like sit together and study the book. जब वो साथ में पढ़ते हैं तो उनका अंडरस्टैंडिंग लेवल बेटर होता है, तो इट इज काइंड ऑफ अ दैट ओनली. अगर मैं कुछ चीज सिंप्लीफाई करके दे रहा हूँ तो डेफिनेटली आप जब इन बुक्स को पढ़ोगे तो आपके लिए बहुत इजी हो जाएगा. दिस बोथ लव एंड बिली एंड सेबेस्टियन आर बेसिकली अ रिव्यू टेक्स्ट बुक. काफी कॉम्प्लेक्स बुक होती है, काफी की इंफॉर्मेशन होती है, बट जब हम पढ़ते हैं इतना ज्यादा दिया होता है कि हम को समझ नहीं आता कि कौन सी चीज इंपॉर्टेंट है, कौन सी चीज इंपॉर्टेंट नहीं है. सो द होल पर्पज इज कि हम पेज बाय पेज कवर करें और इंपॉर्टेंट हाइलाइट्स को आगे लेकर जाए. So to start with, this will be the flow as the other lectures. Few MCQs, जिनका बस एक ही पर्पस है to check your awareness. I would request to answer the chat box. बहुत हेल्प करेगा. अगर आप गलत मार्क करोगे तो और भी अच्छा होगा, because once you mark the something wrong and you get the answer there only, you never forget that. ये बहुत बेसिक प्रिंसिपल होता है. तो अगर हम सर्जरी भी करें, डाउट पूछे आप, जितना भी आपको डाउट बेसिक लगे, यू शुड ऑलवेज आंसर द क्वेश्चंस, बिकॉज इफ यू आर रॉन्ग यू विल ऑलवेज रिमेंबर द राइट आंसर इफ इट इज गिवन देयर ओनली. ठीक है, तो यहाँ पे जो भी एमसीक्यूज होंगे, द आंसर विल बी गिवन हियर ओनली. ओके, सो व्हाट वी आर कवरिंग, वी आर स्टार्टिंग द कोलोरेक्टल मैलिग्नेंसी, and in this we're going to cover today in this session introduction epidemiology, type of colorectal cancers, Colorectal Cancer Genetics. Colorectal Cancer Genetics एक बहुत बड़ा टॉपिक है, बहुत कॉम्प्लेक्स टॉपिक है. We're going to cover A to Z of that, and we're going to cover adenocarcinoma sequence, and the last I'm going to cover the colorectal polyp. So to start with, I'm going to start the introduction epidemiology of colorectal carcinoma. So the first question is, what is the most common site of new cancer in men? ठीक है, मैं यहाँ पे most common cancer पूछ रहा हूँ मेल्स के अंदर. Prostate, colon and rectum, lung and bronchus, none of the above, right? So this is basically a world data, not an Indian data. Just remember that. What is the lifetime risk for development of colorectal cancer in the men in the US? 1 in 10, 1 in 18, 1 in 30, and 1 in 50. So I'm going to start the text now. So the colorectal carcinoma is the third most common cancer in both male and female. And if you see, the most common cancer in the male is prostate and the female is breast, right? So third most common cancer colorectal होता है. Lifetime risk अगर developed country में देखें, हम लोग US में देखें, तो 1 in 18, right? 5.5% in male and 5.1% in female. So it is quite a common cancer. So age is so much important. 90% of new cases are diagnosed older than 50 years of age. This is very important. So in the last 3 to 4 decades, there has been significant advancement in detection and treatment of the colorectal cancers. So survival rate has improved, right? Both colon and rectal cancer survival rate improve हो चुके हैं. This is for every malignancies. So what is the most common site of the new cancer in the men? ये मैंने most common पूछा था. Most common answer prostate है, and the third colorectal is the third most common, and second most common is lung, right? What is the lifetime risk for development of colorectal cancer in the US? Answer is 1 in 18. That is 5% patients को colorectal cancer the lifelong हो सकता है. So now I'm going to discuss. Discuss about type of colorectal cancers. Can any one of you tell me about what is the difference between the familial and the hereditary colon cancer? इसमें difference क्या होता है? Dr. Alpana, Dr. Lakshmi, and Dr. Amit, please you can come on the mic and just tell me We all know about sporadic and hereditary, but what is the difference between hereditary and familial? इसके बीच में क्या difference होता है cancers के बीच में? You can also write in the chat box if you want. So don't worry, I'm going to discuss about what difference क्या होता है. Basically, this both term hereditary cancer and the familial cancer are used interchangeably, but the difference है, छोटा सा difference है. मैं आपको बताऊंगा. Sebastian mentioned hereditary different, familial different. So to start with, there will be few MCQs. So which type of colorectal cancer is characterized by family history, young age at onset, and the presence of other specific tumor and defects? Sporadic colorectal cancers, familial colorectal cancers, hereditary colorectal cancers. ठीक है, इनमें से कौन सा है? ये young age at onset है, presence of other specific tumors and defects, and these are also family history. ठीक है. So hereditary, first type of cancer I'm going to discuss about hereditary colorectal cancers. So hereditary has a family history. They are patients are young age at onset, and there is a presence of specific tumor and defects. Basically, apart from colorectal cancer, अलग tumors भी मिलेंगे हमें साथ में, specific tumors मिलेंगे. एक part of a syndrome है basically. ठीक है. इसके answers है FAP, familial adenomatous polyposis, and HNPC, which is known as hereditary non-polyposis colorectal syndrome. Can any one of you tell me what is another name of HNPC? You can write in chat box. HNPC is the alternate name. Yes, Dr. Lakshmi is absolutely right. Lynch syndrome is another name of HNPC. ठीक है, हेरिडिटरी ये हो गया हमारा. तो कहीं ना कहीं यहाँ पे जो pass on हो रहा है कैंसर from the one generation to the another generation, right? And that is why it is presenting early. There is a family history also, and other malignancies are also present apart from the colorectal cancers. ठीक है, ये basically है. Now, what is sporadic? There is no family history. It affects the older population. Typically, isolated colon rectum involved है, उसके अलावा दूसरी टाइप की malignancy नहीं है. So genetic mutation is limited to a tumor only, number one. And unlike hereditary, specific mutation not present in all cells. Okay? So in hereditary, the mutation will be present in the all cells. They will be another type of the tumor. But in the sporadic, it affects the older age. And it is tumor is only present in the colon and rectum. And the mutation is there only, not present in other cells. So now comes the familial colorectal cancer. That is familial hereditary interchangeable use होता है अब तक. थोड़ा सा difference है, right? Hereditary means something which is passing through the genes. Familial is a type of hereditary, but the slightly difference is there. When cancer patient accumulated in one pedigree, like एक family के अंदर अगर multiple people are involved with the same cancer, then we can say that it is a familial colorectal cancers. ठीक है, hereditary के अंदर colorectal के अलावा और cancers होंगे, and there will be not lot of family members will be involved. So basic difference है, there will be multiple family members of a same pedigree involved in the familial type, right? So just remember that every familial is hereditary, but every hereditary is not a familial. ठीक है. So familial colorectal cancer is a recent concept. So if a person in the family has a colorectal cancers, then the other family member have a higher risk. So risk depend on the certain criteria. Like if the index case is age is less than 50 years of age, then the chances of getting cancer to other family member is higher. It is also higher if the index case is a first degree relative. It is also higher if a higher number of family member have been diagnosed. ठीक है, तो रिस्क की भी क्राइटेरियाज है, लाइक यंग इंडेक्स केस का यंग एज होना, फर्स्ट रिलेटिव होना और नंबर ऑफ फैमिली मेंबर इन्वॉल्व होना डायरेक्टली प्रोपोर्शनल है, जो आपके रिस्क को बढ़ा देते हैं. So first degree relative are twice likely to develop colorectal CA compared to the general population if the patient is diagnosed before age of 50 years. ये बहुत important है. Why? Because you are a surgeon, you are a physician. A 40-year-old male can come to you in OPD, right? So आपको फिर familial सोचना है, आपको hereditary सोचना है young age पे. Then you should be aware कि his family member, if his father, his brother or mother or a sister who are the first degree relative have a twice high chances of developing colorectal cancer compared to general population. So basically, you should counsel them, right? So a tyrosine kinase defect is a particular mutation is found in the familial colorectal cancer. So answer is which type of colorectal cancer characterized by family history, young age at onset, and the presence of the other specific tumor and defect. Answer is hereditary colorectal cancer. अगर यहाँ पे multiple family members होते तो हम familial को हम choose कर सकते थे. So now the next topic is colorectal cancer genetics.